we're pleased to co-host this event on AIDS 2031, taking a long-term view with the AIDS 2031 project at Clark University.
The AIDS 2031 project and the Global Health Council presented a panel discussion about the just-released book, AIDS, Taking a Long-Term View.
You'll learn new things from this book, and I really recommend reading it.
Over the past 30 years, the worldwide mobilization fighting AIDS prevented millions of deaths and generated historic achievements. However, ominous signs suggest the response is beginning to fracture.
I think over the first 30 years of the AIDS response, we really looked at it as if it was an emergency and had a very short-term response to it, really responding with the kinds of actions that would have the most immediate impact. What we're now realizing, and the shift that's beginning to take place in the AIDS response, is that some of the things we need to pay attention to don't respond immediately. They really need investment in some actions that will have an outcome only several years down the pike.
Early on in the response, there was a focus on sort of what's going on. So socially, people were asking good questions. But then as the response evolved and we got treatment, thank goodness, in 1996, there was less of an interest in both in prevention, but also in looking at the social factors and the social drivers, because we had a treatment, we had a way to help people. And the response fell off. I mean, we really weren't getting ahead of new infections in the way that we should have been.
The AIDS 2031 Consortium, a worldwide group of AIDS scientists, public health officials, social scientists, policy experts, and activists, joined together looking at the global response to AIDS and recommended the best way forward over the next 20 years.
The AIDS 2031 initiative makes a number of different recommendations for changing the way that we're thinking about the AIDS response, and then therefore changing the way in which we act within the AIDS response. The most significant of those is the emphasis on taking a long-term view and thinking ahead about the longer-term implications of the kinds of steps that we take now. That would mean a reallocation of some of the resources that we put into the AIDS response.
One way forward is using a comprehensive approach.
A comprehensive approach would include behavioral, biomedical, and social approaches and drivers.
What we're realizing now is that we need to have, in addition to that, also more emphasis on prevention, more emphasis on structural factors that increase the vulnerability of marginal populations to HIV.
Even though the future of the global response to AIDS may be murky, it's important not to forget the gains and achievements of the past 30 years.
Well, I think that the AIDS response in general has done some amazing things right over the last 30 years. I mean, it was a remarkable globalization of the response to HIV/AIDS, that it pulled together a real global coalition, that it activated tremendous amount of global funding for the project. All of that has been tremendous and remarkable. It's put into place the response for treatment and really put a big emphasis on the treatment with antiretroviral drugs, so that too has been a positive thing.
And with the publication of AIDS, Taking a Long-Term View, the AIDS 2031 project is charting a clear path forward.
What's encouraging about the report is that it's very practical, that it really supports, has some very practical guidance, some good ideas about what to do and what can be done, and some truth-telling, which is hard to hear, that we're going to have AIDS with us until 2031, but we don't have to accept the kind of trajectory that we're on now.
We really do have the knowledge that could change the way in which we respond to the HIV epidemic, and we could make a significant difference if we use that knowledge and implemented it in effective and efficient ways.